Because PIP was a criminal organisation, I think we have to assume that all PIP implants have got unapproved silicone in them. That's the only safe way to go now, I think. We know, for example, that PIP used 2 different formulations of its unapproved gel, and that's been called PIP1 and PIP2 gel. They changed in around about 2007, we think, from one to the other. But it's important to understand that when they changed, they didn't change the ingredients. They changed the relative proportions of the ingredients to make the gel more or less sticky. Both of those gels have undergone the extensive medical testing by the TGA, and we've got those results now. So that can give us a lot of confidence that these implants, the gel inside these implants, is not toxic, it doesn't cause cancer, it doesn't affect your reproductive capabilities, it doesn't make you ill. It's exactly the same in that way as medical grade silicone. The big unknown about PIP implants is what the true rupture rate is. Certainly there have been doctors overseas and some in Australia who think that the PIP implants rupture more frequently than other implants. Remember that with any brand of implant there's a known rupture rate of roughly something like 10 to 12% by 10 years after they've been put in. So if PIP implants ruptured 1 in 10 by 10 years, that would be normal compared with other implants. But there's been this suggestion that maybe they rupture a bit more frequently, but we don't know for sure one way or the other. The way we're finding out is that patients are undergoing MRI scans, which will show a rupture with about 90% certainty. Pretty soon, over the next few months, we'll have enough women who've had the MRI scans in Australia for us to be able to find out what the rupture rate of PIP implants is, and we can compare that to the known rupture rate for other implants. Perhaps it's going to come out the same, perhaps it's going to come out higher. Once we've got that information, we can tell patients the risk of having a rupture with PIP implants is so many % after so many years. And that will help patients make informed decisions about what they want to do about that. For example, if it turns out that the rate of rupture with PIP implants is pretty much the same as other implants, there probably wouldn't be any need to do anything else. If we find out that the rate of rupture for PIP implants is much, much higher than other implants, then patients might decide, well, I'm not going to wait for it to rupture like another implant, I'm going to have this out as a precautionary measure. And if it turns out that the rate is somewhere in between, it's a bit more than other implants, then patients can make that decision with their surgeon about what they want to do about it. The French did a test on some rabbits where they injected PIP gel into the skin of the rabbits, and they said that it caused a bit more irritation than normal silicone gel. There were some concerns about that test, whether or not it had been done in the proper way, and so the Australian TGA repeated that test here in Adelaide on Australian rabbits, and it was entirely normal. But they weren't satisfied with that. They then sent the samples overseas to France, to the very same French laboratory that had performed the French test, to see whether it confirmed the results, and it did. Those tests were entirely normal as well. So this means the evidence is that the gel in PIP implants doesn't cause any more irritation if the implant leaks than other medically approved gels. There's so much misinformation out there, media scare stories, and so far there's been a lack of any credible source of information to give the accurate evidence. So if a patient is so worried about it that she feels she wants to have her implants removed, even if there's no medical reason to do so, she should be able to do so. Rupture of silicone implants isn't all that uncommon. We know that it happens in at least 10% of all silicone implants by 10 years. So surgeons are very used to removing ruptured silicone gel implants. It's quite variable what you find when you do the operation. Sometimes it's very easy to remove the silicone, sometimes it's a bit more difficult. But we're quite used to doing that. And we can get most of the silicone out. If there's a little bit left, it doesn't matter. It doesn't harm you. And there are many, many examples of women who've had small amounts of silicone left behind after having ruptured implants removed for decades. And it doesn't cause any health problems. Silicone, of course, is used in other medical devices. An example might be shunts, where pieces of silicone tubing are put underneath the skin to join the arteries and the veins in kidney dialysis patients, for example. And of course, silicone implants have been used since 1963 in patients worldwide. So we know silicone itself is safe in humans.